Thank you very much,
5 minutes.
Madam Chair. Mr. Vice and your wife, I'm so sorry for your loss. I don't have any questions, but I was appalled at the conditions, and we're going to do our best, which is why I was proud to be an original co-sponsor of the bill. So thank you very much for being here. Dr. Keel, I want to talk to you on another date. I have some crazy ideas about residency reform as well, but I love the 3+ program. I think that that's a step in the right direction, and appreciate your innovation there. All right, now I'm going to go to Alan Levine from down my way. As I mentioned in my introduction, Ballad recently was able to reopen a hospital in Lee County, Virginia. The community had gone, and I shortened it up because when you're dealing with it, sometimes time goes. It was actually 8 years that it was closed. And when the hospital originally closed down in 2013, cited 2 reasons: reimbursement and recruitment challenges. So, Mr. Levine, recruitment challenges predate the pandemic, don't they?
Yes, sir, they do, and they absolutely did, and of course they're worse now.
Yeah, and at this point in time, Ballad has not imposed a vaccine mandate on its staff. I'm correct in that, am I not?
Yes, sir, that's correct.
And my estimate, you tell me if you agree or disagree or have some number, but my estimate is that you could lose as many as 15% of your healthcare workers if you implemented a vaccine mandate. Am I pretty close to the mark?
We've had some concern about that, and 63% of our team members and more than 90% of our physicians are vaccinated. But a lot's been said, sir, about the cultural differences in delivery of healthcare, and cultural differences don't change. We're in a part of the country where, for a lot of various different reasons, people have differing viewpoints on vaccines. And so we've tried very hard to lean heavily into educating people, being a source of truth for the community on it. And we're going to continue to lean into doing that. Of course, with the mandates that may be coming down from Medicare, that certainly will change our perspective, because we certainly, with 70% of our paying government, we can't afford to lose that reimbursement.
Right, and the problem is, if you get a mandate from Washington, D.C., and sometimes in our area, and people don't realize it, and you mentioned the cultural differences, we actually see some of these things coming out of Washington to be kind of cultural colonialism by Washington, D.C., and there's a resistance to the federal government no matter what in our area. I'm often reminded of the song Rocky Top, which is actually the anthem of one of the colleges there in Tennessee, where it says, once two strangers went up Rocky Top looking for moonshine still. Strangers ain't been seen again, guess they never will. I paraphrased that a little bit, but that's, there's just a resistance to folks coming in from outside trying to tell everybody what to do. And I'm concerned that there will be a lot of people, a lot of healthcare professionals who will just say, forget it, I'll go do something else. And in this time where we still have a lot of unemployment in some sections, particularly in the coal fields, but in other sections of where you serve, there's an employee shortage. Isn't that also true? For all kinds of things, not just healthcare.
That's correct, sir. And I think that the concern we have, again, a one-size-fits-all approach doesn't always work. The difficulty in recruiting, if a team member leaves, and we right now have openings for 700 nurses. If a team member leaves, getting a new one to replace them is very difficult in a rural region. And so we have been a bit hesitant to impose a mandate while we continue to try to work with and educate our team members. We certainly are for them getting vaccinated.
Yeah.
But the issue of mandate and pushing them away is obviously has been a concern for us.
Well, I think my attitude reflects it. I am vaccinated, but it reflects the area that I represent. I will never vote for a mandate because that's just going to make more resistance to the vaccine and more distrust of the federal government. How much has Ballad relied in the past on traveling nurses, and how much are you relying on them now?
It's, I've served as a Secretary of Health in 2 states through hurricanes, pandemic, the H1N1, and the oil spill in Louisiana. And, I know attorneys generally will prosecute and go after organizations that gouge consumers in the aftermath of a disaster, like supplies or gas. Here we sit where we're now paying $140 an hour for contract nurses. I've been a nurse at one of my hospitals in Johnson City from Vanderbilt. And the reason that nurse is here 4 hours away is because they could get 3 times more money from a contract agency. And so we're getting, right now we have 400 contractors in our system. That's helping to offset the 700 need that we have. But I think this is going to get worse in the aftermath of this. And I'm very concerned about the impact of the incremental cost and the impact on quality that over-reliance on contract agencies has. And I do hope somebody can look into that.
I appreciate it. My time is up, and I yield back.